Welcome to Ortho Reports. You know, sometimes a huge leap forward in medicine doesn't happen in some high-tech lab. Sometimes it happens by complete accident. Today, we're going to look at a fascinating case where a young athlete's really unfortunate knee injury ended up revealing a crucial safety secret, and it's changing how surgeons think about a really common operation. So we're going to follow the story of a young wrestler. His painful injury basically gave surgeons this incredibly rare, real-world peek inside the knee during surgery, and what they saw led to a critical discovery about patient safety. But first, to really get why this was such a big deal, we need to set the scene a little bit. Let's talk about the incredible challenge that surgeons face every single day when they're repairing a torn meniscus in the knee. And it's a challenge they're facing more and more often. Meniscal tears, especially in young, active people, are just skyrocketing with more and more kids playing sports. And that, of course, means more and more of these delicate surgeries are being done. Okay, so during this surgery, there is one spot that every surgeon is laser focused on. It's called the popliteal neurovascular bundle. You can kind of think of it as the main power and plumbing line for your lower leg. It's this tightly packed bundle of critical nerves and blood vessels. And, well, damaging it is just not an option. The thing is, when a surgeon is repairing the back part of the meniscus, their tools can get unbelievably close to this bundle. We're talking a margin for error of just millimeters. A tiny mistake here could lead to some really serious long-term problems. So, you might be asking, how did we even measure this risk before? Well, that's where things get tricky. See, a standard MRI is almost always done with the leg just lying flat and straight. And yeah, there have been studies using cadavers, but neither one of those could ever show you exactly what's happening inside a living person's knee in the actual position of the surgery. And that brings us to our case study. A 17-year-old wrestler comes in with a problem that, just by pure chance, ended up solving this measurement issue. It created this perfect, totally unplanned experiment. So here's what happened. After feeling a pop in his knee at wrestling practice, this young man found he physically could not straighten his leg. It was stuck, locked at a 90-degree bend. Turns out he had a pretty severe injury called a bucket handle meniscus tear, where a piece of the cartilage literally flips over and jams the whole joint. Now, because his knee was locked like that, the doctors had no choice but to do the MRI with his knee bent at that 90-degree angle. And this, right here, was the golden opportunity. That position on the MRI table was almost identical to what surgeons call the figure of four position that they use during the actual operation. For the first time ever, they had a live look at the knee's anatomy in its true surgical state. And when they compared this totally unique pre-op scan with a standard one they took after the surgery, well, that's where the big aha moment happened. This is where the story gets really, really interesting. Okay, check this out, because this is the absolute key finding. After a successful surgery, a standard MRI with the leg straight showed that the distance to that vital nerve bundle was just 5.8 millimeters. I mean, that's tiny. But the pre-surgery MRI, the one taken with the knee bent, it showed a distance of 15.1 millimeters. That is a difference of 9.3 millimeters. It created a safety margin that was 2.6 times greater just from bending the knee. This perfectly shows the core finding here. The simple act of positioning the knee for surgery actually moves those critical nerves and arteries farther away from the danger zone. So, armed with this unexpected good news, this confirmation of safety, what happened with our patient? Let's take a look at his journey from this incredible discovery all the way to a full recovery. Well, the surgical repair went perfectly. After the operation, he buckled down with physical therapy, and just 8 months later, he was cleared to get back to sports. By 13 months post-op, he had completely regained the full, normal range of motion in his knee. I mean, a total success story. But okay, numbers are one thing. How did the patient actually feel? These scores, called PROMIS scores, measure how patients themselves report their outcomes. And just look at this table. His pain interference score absolutely plummeted from a 77 all the way down to under 39. That is a huge improvement in his quality of life. At the same time, his physical activity score went up. The data just paints a crystal clear picture. The surgery was a home run. So let's bring it all home. What's the big lesson here? And why does this one wrestler's locked knee matter so much to the thousands of other patients getting this surgery? The key takeaway is actually beautifully simple. That standard surgical technique, the one that involves bending the knee into that figure of four position, Well, it isn't just to give the surgeon better access. It's an active safety measure. It naturally pulls that delicate bundle of nerves and vessels away from the surgical tools. So what does all this imply? Well, this one single case suggests that the actual risk of this really feared complication might be much lower than we thought. Our old way of measuring the risk, using MRIs with a straight knee, was probably overestimating the danger all along. What scientists had only been able to show in cadaver labs, this one patient proved in the real world. And that's exactly how the authors of the case report put it themselves. This one sentence is really the main lesson of the whole article, and it could go a long way in reassuring surgeons and informing how they approach this very common procedure. It's just a fascinating conclusion that was born from pure random chance. It really makes you wonder, doesn't it? What other medical breakthroughs are hiding in plain sight, not in a fancy lab, but just in the day-to-day realities of taking care of patients? What other assumptions are just waiting for a second look? Thanks so much for joining us.